Thank you.
Hi, everybody. My name's Caitlin Raz, and I'm a professor at UNC in Communication Sciences and Disorders. I'm also a speech-language pathologist. Have any of you heard that term before? Does anybody know what a speech-language pathologist is? Teach people how to speak again. Yep, that's perfect. Teach people how to speak again. Teach people how to speak for the first time. So a speech-language pathologist works in a lot of different settings. So I work right now in our university clinic because we have a speech-language clinic at UNC. I also have worked in schools. I've also worked in a hospital. So speech pathologists work with children. So we might work in a school with children who have trouble with certain sounds or learning certain parts of language. We also work with adults. So we might work with an adult who has had a stroke or some sort of brain injury and they need to learn how to communicate again. We also work with people who are learning how to swallow again. So we work with swallowing as well. So babies who might need some help with swallowing and learning how to eat, and then adults who've had some sort of a brain injury and have trouble swallowing, because it's all the same kind of mechanism that we use for speech. We might work in a hospital. So I'm going to tell you a little bit about where I worked, and it was at a children's hospital in Arizona. So we might work with children who have been in a car accident and have trouble communicating now. So they need some strategies to learn how to communicate again. Or we might work in a school in the classroom setting. We also work in homes. So we do what's called early intervention, where we work with very young children. So that window would be birth to age 3. So we work with young children, coaching families on how to teach their children how to communicate better. So we have a lot of kids who aren't talking yet or aren't talking as much as we would expect. So we teach families how to get their kids talking more. So I want to talk a little bit about the programs that we have at UNC. So we have an audiology program. Does that term sound familiar? You know what an audiologist does? So what comes to mind when you think of an audiologist? Exactly. So they test hearing, fit hearing aids, cochlear implants. Any of you heard of that? That's an implant that helps people to hear. So we have an audiology program. We have a speech-language pathology program. And then we have an undergraduate program that covers both audiology and speech-language pathology for students who want to go on to one of those fields. But they can also go on to lots of other fields. So as far as our undergraduate programs, we have it's a bachelor's program where you study both audiology and speech-language pathology. So students learn how to test hearing, what are problems with hearing, how does language develop typically, what does speech pathologists do to help children and adults learn how to communicate. We also have a certificate program. It's called a Speech-Language Pathology Assistant Program. So students with this undergraduate degree can go out and get certified and start working in schools or in clinics as a speech-language pathology assistant, where they're doing really similar work to a speech-language pathologist. They're just under the supervision of a certified speech-language pathologist. We're also developing an audiology assistant program as well. So with an undergraduate degree in Communication Sciences and Disorders, which is our audiology and speech-language pathology umbrella, there's a lot of different fields that people go into. So some students go on to get graduate degrees in audiology or speech-language pathology. But for a lot of students thinking about, in addition to an undergraduate degree, going on for a big graduate degree might be a little overwhelming at first. So some students go on to be rehabilitation specialists and work in home settings or in hospital settings. They might go on to work in early intervention with really young children. They might go on to work in research or become an audiology assistant or a speech-language pathology assistant. So there's a lot of different routes that students might take. Our audiology program is a 3-year doctorate program, so students graduate ready to be audiologists in any setting, in medical settings, school settings. There's some, I'm going to brag a little bit about our professions because the Best Jobs 2024 just came out, and audiologist was ranked number 76 in overall best jobs and number 20 in best healthcare jobs. There's a huge growth in both audiology and speech-language pathology because there's a huge need with people getting older as well as younger people needing some support in both of these areas as well. The median salary is upwards of $80,000 and then increases from there. So it's a pretty good starting salary right off the bat. And again, there is a huge growth rate in both of these fields. For speech-language pathology, we were number 10 out of all of the best jobs, which is pretty awesome because it's a really fun job. Number 3 in best healthcare jobs. So if we're comparing, speech language pathology is kind of winning, but it's not a competition. Anyways, really good job, a lot of jobs out there. There's a ton of jobs in schools, there's a ton of jobs in hospitals. I get calls like almost every day of people trying to recruit me to work in different settings. Like, I already have a job, stop calling me, but there's a huge need for a speech language pathologist across settings. So I always tell our students, you can get a job in pretty much any state, any setting you want, school, hospital, early intervention, whatever it is. There are so many jobs because there's a huge shortage of speech pathologists right now and a lot of kids and adults who really need support. So like I mentioned, we have a speech language pathology and audiology clinic at UNC. So I wanted to tell you all a little bit about what we do in our clinic. We work with, I think our youngest clients right now are like 4 to 6 months old, and then we have our oldest client was almost 100, so like upper 90s. So we see people throughout the lifespan, both on the audiology and speech language pathology side. And we have a couple of really cool community outreach programs that we do as well. So one is called the Project Life program, and that's our master's students in speech language pathology work at the Immigrant and Refugee Center and with the Migrant Education Program, and they provide speech and language support for children whose parents are taking English classes at the Immigrant and Refugee Center. So they're able to work on early literacy skills, they're able to work on whatever the child needs. It might be, oh, they have trouble saying this certain sound, so we're going to teach them how to say this sound so they can be understood better. It might be the child's really struggling with different language forms or growing their vocabulary, or they might need help with learning how to read. So our students are able to support them in that way while their parents are taking English classes. And then another program, these are some of our students, and that's kind of what a session might look like. They bring all sorts of crafts and fun toys and stuff. We also have it's called the Treasure Chest program. It's called the Treasure Chest program because we give all of our families a treasure chest, so they all get a bin of developmentally appropriate like toys and books, because a lot of families we work with don't have access to really any toys and books, and we want to make sure that they have stuff to work on at home to really help their children to talk better. So this program is for children birth to age 5, and it's a lot of kids who aren't talking yet. So we have a lot of like 2-year-olds who come in, and we expect 2-year-olds to have lots and lots of words by the time by the time the child is 2, we want them to have lots of words. We have a lot of kids who come in and they aren't talking at all. And I don't know if you've ever hung out with 2-year-olds, but they can be like really frustrated and they're just wanting control over their environment all the time. 2-year-olds can be they can be really, really, really difficult sometimes. When they can't talk, they're even more frustrated, right? Because they have no way to communicate what they want, what they need. So we work with these kids to teach their parents, we work with the families to teach the parents how to help their child to talk more, basically. So it's really fun, it's very play-based, but this is all done with our graduate students, and they get to train the parents on how to help their child to talk more. This is kind of what a typical session might look like. Our graduate students are working with the child, and then some other graduate students are working with the parents. So we really teach the parents strategies so that they can help their child and kind of work with their child all the time. This is just one of our community outreach events where we threw pies at our department chair. He did not like that event. But anyways, this is another program that I wanted to actually bring this today, but our ultrasound system that we have on campus was not functioning well yesterday, so I couldn't bring it. But we actually use ultrasound, which, what do you think of? What do you think of ultrasound? Like babies, right? So ultrasound, same technology. We actually got our ultrasound system that we use in our clinic we ordered it in 2020. It was like February of 2020, and then the world shut down, so the university closed, and the ultrasound system got delivered to my house, and I happened to be pregnant at the time, so I was like, let's see. And you could totally see everything. It's the exact same technology that we use to look at babies and other, body parts. I'm not an ultrasound technician, I'm a speech pathologist, but I can interpret the image of the tongue. So what we do is we can put the ultrasound probe right underneath the chin, and we can actually see how the tongue moves. So when we think of what a speech pathologist does, a lot of times people will say, oh, like for people who have a lisp, right? Like for kids who can't produce certain sounds, the R sound is like the hardest sound that we produce. We see kids who can't say the R sound all the time, and when we use this ultrasound, we're able to show the child where their tongue needs to move to produce a really good R sound. So like if a child says wabbit instead of rabbit. Can you hear the difference? The tongue shape looks really different for those different sounds. So we can put the ultrasound probe right underneath their chin, and we can show them what their tongue is doing, and we can say, hey, move your tongue up here or move your tongue down here, and kind of help them to shift it so they can produce a really clear sound, which is something not very common in normal like clinical practice. We have one at UNC, which is really cool, and there's maybe a handful like nationwide where they're using this for speech therapy. So we're actually using it in our clinic, and then we're also using it with a local school district to try to teach their speech language pathologists how to use this kind of technology in speech therapy. We also have a clinical simulation lab, so we let our students practice testing hearing. They get to test babies' hearing. So when babies are born, someone comes in and does a newborn hearing test, and they can actually detect any sort of hearing loss, or if a baby's born deaf or hard of hearing, they can detect that at birth. So our students get to practice on very realistic looking babies, I would say. I will pull up this quick video of the ultrasound. What this video shows is an ultrasound consultation session. So a lot of times we bring kids in to our clinic, and we will work with them for like an hour, maybe an hour and a half, and try to teach them different speech sounds, and then send them back to their school-based speech pathologist or whoever it is that they're working with regularly. So our goal is to use the ultrasound to teach them like where to move their tongue, and then we can send them back, hopefully having learned that sound, and then they can just practice it over and over again. Because to change our speech patterns, it takes a lot of repetition. So like for the R sound, if you all make the R sound, can you feel where your tongue's going? If you say, try it, see if you can feel what your tongue's doing. Because it's something most of us don't think about. I think about it all the time, but most people don't think about it all the time. Can you feel, like, what are the sides of your tongue doing when you say, so they're like lifting up and kind of pushing out. So yeah, it's cupping like this. Yep. Can you feel that? So the sides of your tongue have to go up towards your top molars and kind of push out. Can you feel what the front of your tongue's doing? Curling up? Yeah, so that's, you probably produce what's called a retroflex R, which means the tip of your tongue comes way up. Some of us produce, like mine is more of a bunched R, so it kind of pulls up and back. Anyways, there's lots of different ways of making R, because we all have different sizes of our mouth, sizes of our throat. We have to shape our tongue in different ways to make that sound really clear, which is something, again, most of us don't think about unless you've been in speech therapy and had to learn how to say the R sound, because it's really complicated. So your tongue has to do three things. The front of your tongue has to lift up somehow, whether it's the tip is up or just the front kind of reaches up a little bit, and the back of your tongue has to go down and back, and then the sides of your tongue have to come up. And then can you feel what your lips do? They kind of pucker a little bit. So those are all, like all of those four movements have to happen perfectly timed every time you say an R sound, which happens a lot because we have a lot of R sounds in our language. So it's no wonder that some kids struggle with making that sound. Okay, so this is a quick overview of what that consultation session looks like. Here we go. Okay, so this is that sagittal view again. So the tongue tip is right here, and then the back of the tongue is right over here.
Ooh, that looks amazing. You see it? Oh my gosh, you're moving it around. Are you lifting the tip of it? Yeah, see how we can see it? It looks so good. So yeah, that's the very tip of your tongue. Lift it up again. Lift it up again.
So you see that tongue going up a little bit?
How about we say ra? Can you do that? Ra. Yeah, okay.
So what'd you notice? When that kid just said raw, it went down, right? The front of the tongue went down and then it pulled back. So that's the opposite of what we want to happen. We want the front of the tongue to come up and the back of the tongue to go down. But in this case, the front went down and the back went up. So then we have to try to figure out how to get that kid to understand how you need to move your tongue. And like, how do you get that front of the tongue up and the back of the tongue down?
Do you remember where the tip is? Right there. That's the tip of your tongue. Raw. Raw.
Straight down.
Ooh, where was your tip that time? Did you see it?
I think you were pointing forward.
It was kind of pointing down. So we can think of it pointing down or up. So let's try, how about re?
Oi.
Yeah, good try. Remember, let's look at the very tip. Yeah.
So you can see this kid was really good at getting his tongue up when he wasn't thinking about making that R sound. Because what our brains do when we think about making a certain sound is they automatically do what we're used to doing to make that sound. So like if you all are gonna say R, rah, like your tongue's automatically gonna go into that perfect position. For this kid, his tongue, when he thought R, his tongue was just gonna go down and flatten. It was gonna sound like wah instead of rah. So you can see him like lifting his tongue up and he's like, I'm getting it. And then as soon as his brain thought of that R sound, it immediately dropped. I'm gonna show you one other view, and this is our coronal view. So this is like if we were looking straight into the mouth and you can see those sides coming up. So the shape we want is like a bird with its wings up is what we say. So it's like a big kind of swooping movement where the sides of the tongue come up and hit those top teeth. Let's see if I can find it. Here we go. That R sound, can you feel what the sides of your tongue are doing? Like can you feel where the sides of your tongue are? Like right here and right here?
Yeah.
So can you lift those up towards your top teeth? Can you all see that image?
That's perfect. Yeah, good
So
job.
that's the shape we want.
Nice.
All right. So now we want to hold those sides up and then try that sound again.
Oh.
So did you see what happened? Oh, it went flat. As soon as we said his sides went flat. Almost. What did you think about that one? Is that shape or was it a little flatter?
It was a little bit flatter.
It looked a little bit flatter to me.
Yeah. Ooh, yes. Just like that. Now
So we
let's
can
try
do
a
it.
sound with that.
Oh.
That sounded different to me. Maybe we try ear.
Yeah, ears. I like that. Right? Even if you just say E first. You do that for me?
E.
Mm-hmm. Can you feel the sides of your tongue? Kind of up by your top teeth and you go E. Mm-hmm. That's kind of how we want it. So what if we go ear, like your ear?
Ear.
What?
So that one sounded better.
That sounded really, really close. That sounded very different to me. Could you hear that?
We get really excited about good R sounds. Like sometimes we scare kids because we're like, oh my gosh, you did it. And they're like, whoa, okay, calm down. But that's what our ultrasound looks like. And we can use it for the R sound, we can use it for the S sound, any of those sounds that kids typically struggle with. And we can see those different movements. We can kind of help them to understand it a little bit more. And then we also have, we also do auditory brainstem response testing. This is something that an audiologist would do, where they can actually test how the brain responds to different sounds. And this is something we do in our clinic, and it's something that an audiologist would do out in the field. We also do this with animals. So I actually took my dog in and had her hearing tested. So they can use a little electrode probe that they put on the animal, and they do this with dogs, they do this with horses, they do this with, they had some cool partnerships with like zoos where they were testing other animals' hearing. Don't ask me how they did it, but they did. And they go in and put a little electrode, and then they can see how the dog or the whatever animal it is, how their brain responds to different sounds. So we get a lot of litters of puppies that come to our clinic, because to be like certified under a certain breed and be whatever, like be able to go to dog shows, I guess, they have to have this testing done so they can show that their hearing is like perfect. Or if they're going to be hunting dogs, their hearing has to be really, really good. So they bring the whole litter of puppies in, and then our students get to test like puppies. So it's really fun because I'll like go down to the clinic and there will be a whole litter of like cute puppies, which is not something you would think of that an audiologist might do. But we have a special certification where students can get certified in testing like animals' hearing. And then we also do other types of hearing testing with adults and children. We also have a voice clinic. So this is what's called video stroboscopy, and this is something that a speech-language pathologist might do. So I'm jumping back and forth a lot. Speech-language pathologist, audiologist. We overlap quite a bit, but we also do very different things. So this is something that a speech-language pathologist would do. And this is looking at the vocal folds themselves. So like our voice box, this is where our vocal folds are. If you make a sound like this, zzz, try it. Put your hand right here and say zzz. Can you feel what happens? Try making a sound like this. And now try. And now go back and forth. Can you feel anything different? What do you feel? Vibration, exactly. That's because your vocal folds are actually vibrating, and that's how we produce our voice. So our vocal folds, if you can see, that's what your vocal folds look like. They're like thin strips of tissue that vibrate, and they open and close. They close when we swallow to protect our airway, and they open when we're breathing. They close and vibrate when we're speaking. They might not vibrate on certain sounds. These are all things that we look at through this video stroboscopy testing. Have you ever heard of vocal nodules or nodes? A lot of singers call them singers' nodes. So Adele had nodules kind of recently. Julie Andrews, I don't know, it's not relevant. Anyways, a lot of, not a lot, but singers and people who use their voices professionally are much more likely to have trouble with their vocal folds, their voice box, because they're using their voice all the time. So they might develop what are called vocal nodules, which are like little calluses, just like you would get calluses on your hands from overuse. They're like little calluses on the vocal folds. So what we do as speech pathologists is we go in and we can actually use this. There's a camera that goes in your mouth that shines down on the vocal folds and we can see what they look like. There's also one that goes up and through your nose and kind of hangs down. I know. It doesn't feel great, but it doesn't hurt. But it allows us to get a really good view of the vocal folds moving, and we can go in and see what's going on with the vocal folds and all of the structures around the vocal folds and what's called the larynx, to see if there's any structural issues, if there's any nodules or something that might be causing a person's voice to sound really hoarse or to not kind of let them sing the way that they want to. And then we do voice therapy with those individuals to help them to use their voice in a really healthy way so that they're able to keep singing or keep talking or whatever it is that they need to do to use their voice for their job. We also have a gender affirming voice program where we work with people who want to change their voice to better match their gender identity. So we do voice groups, we do individual voice therapy, and we teach people how to make their voice pitch higher or lower, for example, and how to present their voice in different ways. And that's something, again, that a speech pathologist would do. And then we have lots of other types of measurements we do for analyzing what our voice sounds like. So I want to tell you a little bit about my background and kind of how I got to where I am. I grew up in California and I left to go to Washington for my undergrad degree, and it turns out it rains a lot in Seattle. I don't know if anybody knows that. It's really gray. So I left and I went to Arizona State for my master's because I thought I want to go somewhere that's sunny again, even though I loved Washington. So I went to Arizona State, and that's where I learned how to be a speech pathologist. That's where I got my master's. And then I started working at a children's hospital in Arizona. It was a pretty large children's hospital. I worked in outpatient rehab, so versus inpatient. Does everyone know the difference between outpatient and inpatient? So in outpatient, I would see families who would come in like once a week, twice a week for therapy and then leave, versus inpatient, where you would see someone who is in the hospital for a certain duration of time. Speech pathologists can work in both. I just liked outpatient more. So I worked in outpatient. I saw a lot of children who had a really specific speech disorder called apraxia of speech. So this is, does anyone know what apraxia or praxis means? That term sound familiar? So it's difficulty with coordinating movement. So these are kids who know what they want to say, their cognition, they understand everything really well, but they can't coordinate their mouth movements basically to produce speech that can be understood. So as you can imagine, it makes it really hard to communicate when you can't like coordinate your mouth. So you see kids doing kind of like that, like trying to figure out like where does my tongue need to go. Also something that happens sometimes with adults who've had a stroke or some sort of brain injury. In kids, we don't know why this happens, but it's really severe and they have a really hard time communicating, and they get really frustrated because they know what they want to say, they just can't form words in a way that they can communicate effectively. So we were seeing a lot of these kids, and it was really confusing as a speech pathologist because we didn't have a lot of research to guide us in what we should be doing to diagnose these kids and then to treat them, to help them to talk better. So I started seeing more and more of them, and I was like, I really feel like I should go back to school and do some research in this area. So I went back to ASU, and I got, that's where I did my PhD, and I ended up in a genetics lab. So there's this whole field that studies the genetics of speech and language disorders and like really severe speech and language disorders. So we were able to look at like families, for example, who have this disorder, this really severe speech disorder running in their family, and we could identify different genetic areas that were associated with this type of a disorder. And then we also did EEG. So this is where we can measure electrical potentials on the scalp, like electrical potentials of the brain at the scalp level, and we could look at, this is not a child with apraxia, this is one of our research assistants, but we were able to look at children who have this disorder. We could see that their brain activation was different from children without this disorder, and we could point to like certain ways that they were responding to speech sounds, certain ways they responded when they said speech sounds, and we could say, oh, this is a little bit different, and this is a way that we could maybe treat this disorder a little bit more effectively. But then I decided that that was not really where I wanted to go, because I'm a speech language pathologist at heart. I'm not a geneticist. I don't have that kind of knowledge, and I like working with people. So I ended up going to Syracuse University to get to do a postdoc, and that's where I learned about the ultrasound that I was talking about. So here's some pictures. If I have time, I'll show you a quick video too. But this is what the ultrasound looks like. So you can see that some of these images look pretty different, right? This is an incorrect way of producing R, and this is a correct way of producing R. And what this is showing us is the front of the tongue and the back of the tongue. So like if you were looking at my tongue this way, like that's what the image is showing you. And you can see like with a correct production, the front of the tongue kind of lifts up and the back of the tongue goes down. And these are things that we can teach kids how to like move their tongue in different ways. I also have a small business that develops content, training content for families who have kids who are struggling to learn how to talk. So right now we're actually working with communities in eastern Colorado and rural communities where they have very limited access to speech and language services. And we are training community health workers, so community members who are doing home visiting with families. We're training them in early language so that they can help support families to help their children learn how to talk more. And then we created a bunch of content for families in different languages so that families can be supported in like English and Spanish, for example. So there's a lot of different ways you can go in this field, and that's kind of one of them. A lot of people have developed their own businesses. A lot of people have developed YouTube content and Instagram content to get information out to families and speech pathologists. Okay, and I think that's it. And there's my email if anyone has any questions.